Sent a mail now, and
Yeah.
she writes unable to log in with a link. There is a problem with the link. She
There's a-
writes.
Oh no, we all registered. We all signed in. Let me send her again the link.
Yeah,
Or...
maybe.
Is she in the same hotel as you, Gaza?
No, I'm in my home, my friend's home. I am not in hotel.
Oh, okay.
Yeah, my friends has a home here, and I'm in a home.
Oh, nice.
Nice,
Okay,
yeah, nice.
very good.
Yeah.
That's why, so you could be in the same room, couldn't you? I thought you'd be sitting side by side.
I think it, but time is too early for that. 6 a.m. Maybe after in the afternoon we could be together, but in the morning we are separated.
Yeah, I'm not surprised. Yeah, I had a very early start this morning as well, but for a different reason. But,
By the way, Roger, you know, our research about refugees, we are ongoing on a research. I told you before about refugees in 1 year in my hospital. But this number is very high, and my residents, my assistants, still searching for that. And now the number of they calculated it 3,000, but they are searching up to 10,000 refugees. So we need more time to actually research again. Actually, we need a little bit time because I couldn't send you some information because I'm still waiting.
oh,
for
but
the result of
what you did was so helpful to my student, and it was enough for her to complete her paper. And she's going to go on and do further work on it.
But I will also send you another result of our research. But I am waiting still.
No hurry, just whenever. And I'm very happy to read your draft paper when you.
Thank you. I appreciate you. Thank you so much.
Send it over when you're ready.
Okay, I will send it. I'm waiting.
We will cooperate, on
Thank you
shared
so
interests. So, that's
Okay, so I sent Colleen that we logged in again just now, the email. So tell Colleen that check her email. I sent that link again. He logged in, you logged in.
Just a minute, I say it maybe in messages.
Yeah. Okay, so Roger, another thing I was thinking about, CSocD, the Commission on Social Development, usually gives me the side event. And what you can represent from a migrant perspective, that giving the driver's license is, because this is a debate in Massachusetts, so it's a real thing. Giving migrants and refugees, because state of Texas and Florida has sent the busloads of migrants to Massachusetts. So there is busloads to the New
I've heard about that.
Massachusetts got plenty, and same is with the New York, because we are friendly states or whatever you call it. Anyway, so on our ballot there is one of the questions: should we give driver's license to these refugees and migrants, because by the time they get their hearing it'll be 2-3 years. So if they have a driver's license and they can work part-time and contribute to the society and vet out who are the good migrants and who are the troublemakers. So what's any views on, same thing is in the Turkey, I'm sure, giving the driver's license or license to work, that will be the good theme for social CSocD, because their priority theme is working equal pay to have a better life. That's what their priority theme is. And that's what this written statement is all about. So what do you two think?
Roger.
After you.
Yeah, I mean, about like driving lessons, or you mean, actually I didn't understand actually.
Actually the question is, if we give them here, we need say driving license because distances are so far, so they can go to work, or work visa. How about that? Work visa or a part-time work permit for the migrants?
Work time permit, maybe. I'm not sure if they give refugees driving license, they can work. I don't have any idea about that because they need to register in as a Turkish. If they want to work in Turkey, they need registration. The rest of them working unregally. They are working unlegal. So they don't have any permission for that, actually.
Colleen has joined us.
Excellent.
She's connecting, yeah.
Yeah.
Okay, so go ahead, because this will be a big problem for Europe and America both, because millions of these refugees are sitting at their border and the
Yeah.
different states, and how do we put them to work, and how can we be a social productive person? Yeah.
I mean, in the UK, the situation is very bad because
Yes.
we do not give them the permission to work,
Yeah,
and we give them just a few pounds a week to try and live off, and it's inhuman, and they are willing to work. They're desperate to be allowed to work,
Exactly.
but it's just caught up in toxic politics.
Yeah.
And the British government is making life very difficult for everyone, all migrants and asylum seekers, you know, a lot of them are detained. They're not able to work. They've got limited access to any sort of benefits, healthcare, and so forth. So I'm deeply unhappy with the situation here at the moment. And it's not improving. The government is they're just not interested. They want to create more barriers. They want to make it more difficult because it suits their political ideology.
Yeah.
It's nothing to do with human rights or welfare or common sense even.
Yeah, same in Turkey. Yeah, actually, they don't have any permission for work, but they are most of them working, as I said, unlegal.
Yeah, because in Massachusetts we have this debate, and we call it a driver's license to work because here the distances are far. Colleen, can you hear us?
Yes,
Hello?
I can hear you. I can hear you. So I'm on here, and
good.
it really varies in the U.S. depending on which state you wind up in. But you know, these people have been bused and flown to all kinds of places, and it really is. It's somewhat of a mockery of their coming in here. The places where they can get a work permit, though, is great because we need the workers in the U.S. I mean, our unemployment rate is under 4%, and we have a lot of industries that need these workers, and places where they're able to start to get work. I mean, these refugees are more than happy to do jobs that Americans won't do. But there's so much of the rhetoric and the hateful stuff, and well, you know, we don't want you in our state, so we're going to bus you to a liberal state, and that kind of crap going on. So, you know, I mean, a work permit would be good for everybody. In the United States, it would be so helpful for, you know, and even for professionals. I mean, our children's hospitals are dying right now because of the lack of nurses. We have, you know, beds that are closed, and so the kids who are sick are sitting in the emergency department, and it's a 12-hour wait to be seen in the emergency department, and the clinics are backing up. And so, you know, they could be quite a solution for some of our workforce shortages if we were humane and smart enough to do it the right way.
It's exactly the same here in the UK, Colleen. It's exactly the same. I mean, it is inhuman. And yeah, the same workforce issues here. I mean, because of Brexit, it's, you know, the situation is really serious because a lot of Eastern Europeans who used to do the low-paid jobs, carer in the social, they were carers for the elderly in care homes, nursing homes. They were nurses and so forth, and they've all gone back home because they thought they weren't welcome here. So we've got acute shortages in the hospitals and in care homes, and we've got a workforce that is desperate to be allowed to work. But it's just, you know, this mindset that will not make it happen. And I don't know how we change that mindset.
Colleen, before you joined her, that's the question I posed to Roger and Gaudi was this. Massachusetts and New York are the good states. They don't throw away the migrants and sending anywhere. They are accepting busloads from Florida and Texas and wherever they are coming from. So we have a ballot question. Should we give these migrants driving license? I was explaining to Gaudi, we call driving license as a work permit because their distances are far off. So to get a job, most of the jobs require you have to have a car or an access to a car so you can come to the work or work visa. So we have it on our ballots, and that's why I was asking for it. And this will be a good topic for this CSocD. They usually give me the side event. Whenever the side event will open, I will fill it up, the form, and I'll send you the copy of that form. And because their priority theme is the work for all, a decent work for all. This is their priority theme. So this is the topic, and this is the area you three should be working on it, and develop your own recommendations for you for Turkey, for you for UK. Colleen, you can add the healthcare professions like you just were saying. We need nurses, we need orderlies, we need all medium categories. And I mean, if somebody are the doctors and the nurses from other places, they can go to the proper training and maybe a useful citizen someday. So that will be the perspective I will suggest you three.
Well, I
Rita,
think that should become part of the whole policy discussion, and certainly
Yes.
what you need to get there, like a driver's license, is important. I mean, all those pieces that can come with a temporary visa status is all makes sense.
Rita, can I ask you something? Because I'm a little confused, because you wrote to us recently to say that you have joined HESI, the Higher Education Sustainability Initiative.
Yes, that is for the other sessions, yeah. But CSocD is, their priority theme is the work, decent work. So yeah, no, that is very important, yes. If we don't, if the CSocD is way too, last year they were asking $2,000, and I had just finished the CSocD, which costed me $7,000 after paying them. I said, no, I don't have $2,000, so I didn't accept their offer. You guys came in my world little later, so you don't know about CSocD and CSW. That's why I was trying to train you from beginning. That these are the sessions I get involved in it, and I spent 20 years to learn what the UN has to teach me. I didn't go to Yale to learn it, but Yale students also are there doing internship with me over there. So anyway, so that's the way it is.
I'm already affiliated with HESI.
HESI, good. Then you can lead it, because if CSW asks too much of money, then I will refuse for the side event, and then I'll go for that commission for science and technology, which is one is in April, another is in May. And then, of course, we will go to the HLPF. Now we are established with HLPF. That is the number one, because that is the economic part of ECOSOC. And the CSocD is social part of the ECOSOC. So these two are really important main things. That's why the president of ECOSOC sits in these meetings, and it goes through their offices. Yeah.
Right. Okay. But I mean, with HESI, you know, I'm on a subgroup which is affiliated to HESI for sustainable development work, and so I've got a fellowship with this group called the SDG Publishers Compact, as you know, through Deborah. So we've got access to HESI, but we don't pay them anything, and we have no funds anyway. So you know, we're not going to pay thousands.
No, they give you that. If they love you, just like Harvard, if they love you, they give you in, but you have to buy your books, you have to buy your clothes. That's what the side event is. If you want to speak it there, written statements are free, But if you have to speak there, then there are certain expense they endure. There are certain expenses I endure because of all these arrangements and then going and posting it, all that stuff in a global health lines and all that stuff, which these 7 technicians, which are under my employment, part-time, maybe most of them, but eventually there are a lot of humans, and no humans work here in USA without paying them. So eventually the buck stops here. I mean, I am spending still, I'm retired now, 100,000 on this project's publishing and all that stuff, whatever I need to do. And I have an editorial assistant now. But when I was working, it cost was a lot more, and I had 2 editorial assistants because now I do most of the work myself in-house, but nobody's paying me, but I love it. That's okay.
Wow, that's a lot of money.
It's a lot of money. Yes, it is a lot of money. But that's why I said before you offered me to publish your ethics thing, I said, I will do editing part and keep it ready for publishing on the this website on Global Health Line in 6 languages, whatever. It goes all in 6 languages. But after it goes from my office, then the meter starts. And
Right.
they charge $150 an hour. So depending on how complex, hey, the techs are not cheap. Instead of becoming a doctor, I would have become a tech now. So what can you do?
Yeah, well, that's not possible. Colleen and Gerta, I was emailing Rita last week about the possibilities. I'm trying to find a new home for the online course on medical ethics. I think, Gerta, we've talked about it before because when we met in London, because I developed this course some years ago, about 5-6 years ago, mainly for developing countries, for healthcare professionals who had no training in medical law and ethics. And it was quite successful. It was run through an institution, an open university, open access project in Australia, but they ran out of funds. And so the course is no longer available. And I've got all the materials written. And my idea was to record the lectures on Zoom and put it on a YouTube channel. But I don't have any assistance. I mean, I can do that and create my own channel, but I just thought maybe we could do it through WHEC, through Rita's group. But clearly that's not going to work. So,
that's right. Like I said, I will spend hours and hours to keep it ready to go on electronic part, but when it goes there, they charge $150 an hour. And
no, that's not possible because there's no funding for this. I've already given up all my time to do it. But I'm happy to, I just want to make it available because, I've got students who have had no training in this. And I think, we spoke about this in connection with Turkey. So I'll just keep it open. Because obviously with Turkey, there's a language issue. Someone would have to translate it. But I mean, if your institution and if you're, if either of you have got suggestions, I'm very happy to share the materials. I have PDFs of all the slides, and they're reasonably up to date. UNESCO published some stuff on this. Well, they call it bioethics, which is actually, in my view, a slightly different thing. But the UNESCO stuff on bioethics is just awful. It is so bad. It's just not believable because they try and make it global. And of course, this subject is very specific to individual jurisdictions. So what is legal and ethical in one country is not necessarily legal and ethical in another. So when I wrote the course, in order to address that, I just gave examples from 2 countries, one developing, one developed, as examples of how this stuff pans out. But then if somebody from a developing country, another country wanted to use the materials, they could develop it in their own language and in accord with their own laws. But there's quite a bit of work to do that, and I'm mindful of that, and I don't have the resources for it. But I don't want to take up all the meeting on that. But I was just floating ideas to see if I could get this off the ground. But there's no hurry. It can sit in the background for now.
Sure, it has to, because at this point we are discussing, you three definitely will have the policy recommendations, because this is the forum to send your recommendations, or either you send it in the written statements, which I did not focus too much on migrants. I just focused on the general women in my written statement. But you three are experts on the migrants, and that's your passion too, which is good. No, I was a migrant too once, whatever, 45 years ago, but that's okay. Landed on my feet, so that's
So
fine.
what specifically do you want from us? I'm still not quite.
Okay, for CSocD, which is in February, I think the UN is bending towards keeping in-person and virtual both. Okay, because NGOs are not letting them go, and they also realized after years and years of being a hardliner. Otherwise, for every single meeting, I used to go to UN to New York, and traveling and all that expense adds up in 100,000. That traveling, and of course, I have to stay in a hotel. I mean, I don't have friends there, like, and I don't want to impose on friends either. So they has to be on their ground. Now they realize it, but how will they integrate with UN Web TV? Earlier, it used to, whatever those side events were discussed, of course, they were on their ground. We used to pay about $500, and it was their recording people, just not like mine people. For us, I did. And for 500 people, their people record that side events. And then they put it on UN Web TV, which was good to see. But these virtual side events were outside that. So they did not put on UN Web TV, but they put it on their, like CSocD put it on their channel, Commission's channels, which is okay. But I like to see us on UN Web TV, because that goes all over the country. But how will they integrate UN into these two things? I think in 2023, because nobody expected this COVID thing will go on for 2 years. We thought it's just 6 months. Then it went on and on and on and on. So how will they integrate these two? We'll know soon.
Yeah, but I mean, the thing is that the UN has got this whole sustainability agenda, and they're putting lots of resources into sustainable development. So you can't then require everybody to fly to New York. It's just from the environmental point of view, it's madness.
Yes.
Apart from the inclusivity and promoting open access, equality, and so forth. But can I just ask you, what is the name of the event in February? Because there are a lot of different things going on. And I'm confused.
Commission for the Commission of 61st session of Commission for Social Development.
Right.
Okay.
It's from February 6th to 15th.
Okay, Feb 6 to 15. Right.
Yeah. And I usually ask for first 4 days early, and usually I get first 4 days, because the first 4 days are all the important people speaking there.
Okay. So what you're looking for is a proposal for that.
Yes, but this proposal for CSocD should be the work and migrants and refugees. How can we integrate? How can we discuss with our politicians and explain that this is a benefit win-win situation? They are not taking the jobs from Americans. America, or I mean, in UK, I'm sure you must need a lot of employees for doing whatever the low-level jobs. Don't call it low-level, whatever jobs. Challenging jobs, okay? Don't use the word low-level. Challenging jobs, which or hardworking or backbreaking.
But these are political decisions. I mean, these decisions are made in Washington, and none of us.
No. But who influences Washington? Who influences international policy? These NGOs, because eventually NGOs have a volume or number. They are only, how many UN people were sitting there in the that 40-story building, most of the delegates and everybody are their NGOs, maybe national NGOs, but they are NGOs. Real UN people are only 2,000 people in that 40-story. Rest of the 10,000 people are from NGOs. Either they are supported by the private investors or these NGOs are supported by the countries. Yeah.
Okay. But I mean, you're talking also about a United States policy. I know it applies to other
Yes,
countries.
Colleen and I, we will focus on,
Yes.
it will be mine. Colleen will focus more on healthcare and the children. I will focus on in my introduction. Yes, in Massachusetts, that thingy is there, and it will. Our voting is on November 8th, so I will know by 8th whether this question passed or not.
Right.
If it passed, then I will say,
Okay.
yeah, good job,
Can I make Rita, can I make a suggestion? Because I don't want to get involved in the politics of it, because it's not my field of expertise. But if we look at this from the point of view of sustainable development, the SDGs, this topic addresses SDG 3, which is health, 4 is education, 5 is gender equality,
Yes.
10 is reduced inequalities socially. So 4 big SDGs. I could put together something around the ethics of it and the sustainability of it. And then if that has political associations, that's fine. But I have no power or willingness to try and analyze.
Nobody has a power. Nobody has a power. But this is the forum. This is the place to express your opinion.
Yeah. But if I were to do something for you on this, I would put it within the context of Sustainable Development Goals.
Sure.
And then we can
better because none of us are.
Colleen, how does that strike you?
That's perfect, because my perspective will be putting an example that Massachusetts, hopefully this passes, succeeded in. So this is a good framework.
Put it into a metric we've all agreed on. So yeah.
Yes. Yeah, definitely. So for CSocD, this will be the angle. You can tell us, Gaudi, what Turkey is doing to get them in work environment. Okay. Now, HESA, we will discuss, I think, in another session, but that's important. Okay. Like I told you, if not CSW, then of course CPD and STI conference, which are coming in April and May, that HESA will be discussed, and it will be the main thing for HLPF. That's for the rest of the year. But since CSocD is social development and the work is their priority theme, let's stick to the priority theme. Yeah.
Okay. So Colleen, can I just ask your thoughts about this? If I were to frame this in relation to the SDGs and provide sort of the context within sustainable development, because that's where so much of my work is going at the moment, then would you be able to provide the contextual stuff around the refugee policy in the US, for instance, like some of the madness?
Absolutely, and really how it aligns with the Sustainable Development Goals, and then really maybe how it is not really being implemented in that way.
Right. Well, I think we've got an idea in that case, because I mean, like last time, I provided a framework, and then we got down to the detail. I mean, I can do the same here, but this time the framework will be the SDGs, which of course is a UN initiative. And because of my work through the higher education sustainability people, and I'm now sort of co-leading this working group, then we're very busy promoting SDGs in lots of different ways. So it's entirely consistent with what I'm doing at the moment. So if I put together a framework, and then if each of you are happy to provide that in depth, because you've both got so much expertise within your countries and and the issues, then are we happy to use that framework? But obviously it's a different topic this time. Instead of education and healthcare professionals education, it's sustainability, and it's so high up the agenda at the moment that I think I would be surprised if the Commission did not want to have a piece on this issue.
Well, I think it's really important because the people who are very anti-migrant and anti-refugee are basically saying that the number of people coming into our country is not sustainable. And in fact, to turn that around and say, our fragmented systems who really need workers are not sustainable. They could actually be helping to solve the problem. And if we keep that in the framework of sustainable development goals, and we think about these people as a solution, I think it could be really impressive.
Yeah, that'll be very good. Yeah, this is the best angle. Absolutely. Why don't we meet again via Zoom to, let's say, in December or I'm free for you three. I have all the time. But I know Colleen has a very busy schedule, and being the different time zone between Turkey, UK, and USA, and definitely Colleen also 3 hour. Whatever time works for you guys, because I am working from home, so no problem.
Yeah. Well, I mean, for me, the time frame, this month, I'm absolutely committed. But November, I could produce a set of slides, for instance, by this middle of November. So what if we met at the end of November to put this together?
Because
does that sound okay?
And when are we thinking about doing the webinar? That would be the end of November?
Yes,
Okay.
end of November, because I'm going on 2-week vacation, end of October, Canary Island. I'll be back on 8th. So anytime after 9th will be fine for me.
Okay, I think, Colleen, I think with the November date is just for a discussion. I think.
Okay, so maybe thinking about that later on for the actual webinar.
It will be February the 6th to the 15th.
Oh yeah, actual webinar will be when we get it, the exact date and time from them. But when I'll fill that form, I'll send you a copy of the forms, so you'll know what has been written. Yeah.
Okay.
Well, I can almost wave to you, Rita, when you're in the Canary Islands, because at that time I shall actually be in Mallorca, which is another Spanish island, but just the other side of the peninsula.
Oh, that's so funny.
So,
That's
when are you going to be in New York, Roger?
Pardon?
Yes.
When will you be in New York?
Not New York. No.
Oh.
I'm going to. I spend a lot of time in Spain, but I have an office in Mallorca, one of the islands.
Oh, okay.
So when Rita is going on holiday in Paris, I will
actually it's a cruise, Roger, and we are stopping in Spain. So.
Oh, right. Well, if you come to Palma in Spain, you'll have to tell me. I can meet you there.
I'm going to be there next week.
Really?
Mallorca.